Good afternoon, everyone. It is 2:30. Welcome to CCDPH Schools and COVID-19 Weekly Update. My name is Kelly Jones. I'm a senior health educator with Cook County Health Department. In the Community Engagement and Health Education Unit, I will be your host for the weekly webinars if you are not familiar. Before I go on and toss it to Lex, I just wanted to give a few announcements and updates. As usual, we are here for our meeting objectives are to provide updates to schools and support them while navigating COVID-19. We know that things change by the minute, so we are trying to give you the latest and greatest of information while we can. We're here to answer our frequently asked questions and provide CCDPH contact information and any other pertinent resources. A few announcements. All webinars are recorded and they will be uploaded onto our website. I've been told that our webinar from 7/23, the first one in this new fall series, is already uploaded to our website for your viewing, and the one from last week will be uploaded shortly. So you may go to our website. I will put the website in our links, and I also have them in our slides, and I'll put them in the chat, and you can go to our website to find that. I send out the slide deck weekly. So all registered participants will get a copy of the slide deck from every week, and our recordings are on our website. Speaking of contact information, here is our general CCDPH COVID email, ccdph.covid19@cookcountyhhs.org. If you have communicable diseases that you would like to report, not just COVID, you may email them now to the Communicable Disease Department at ccdph_schools@cookcountyhhs.org. Our general Cook County website is listed, as well as our schools page. On our schools page is where you will find those links for different contact information regarding school issues, links to IDPH, CDC, as well as those recordings, and a link to register for upcoming webinars. There's also our COVID-19 vaccine website, as well as our vaccine communication tools. I'm sorry, I got schools on the brain. Tools website. I've had some people reach out asking questions about printed materials they may want to use within their school. On our vaccine website, you may find some items that you may download for your use, and they may be information on masking, pictures on masking, information on the vaccine, and information and frequently asked questions on COVID-19 as well. So all of those are on our website, and they are available to download for your use. Just so you are aware, all of our mass vaccination sites are closed. We have moved on to a smaller, more hyper-local response to vaccination. And speaking of which, our hyperlocal strategy is concentrating on the following communities that are listed. These communities, we are going to provide some extra support and some resources in order to provide education and outreach, and in hopes to raise the numbers of the vaccine intake in these communities. If you live in the community, if you work in the community, if you'd like to host educational and vaccine events, if you have great ideas that we should hear, please email them to ccdph.covid19@cookcountyhhs.org. For those of you that participate in our Epipen Requests program, Keith Wynn is no longer coordinating the Epipen Requests. Those can be sent to me, Kelly Jones, at kjones1@cookcountyhhs.org. Our doctor will provide a signed order, a standing order, and a prescription, and you may fill that at the mitigations that is set forth by your district. And I also can answer some questions if there are any questions regarding that process. The County Health Department hosts a school health advisory council. We are looking for new members. There have been a few people who reached out expressing interest. I appreciate your email. I will be in touch regarding our upcoming meeting. But for those of you who weren't here last week and saw the announcement, our School Health Advisory Council assists CCDPH in keeping abreast of community needs. They help to plan the school health conference and other events. They advise CCDPH on course of action regarding school communication and needs. And if you're interested in joining, we welcome a wide range and diverse population. We have people who are from the South, North, and in various occupations, which helps gives us that diverse voice. We welcome you to contact me and I will be in touch. We may not be able to accept everyone who reach us out because we have a limit on how many people we're going to have on the advisory council, but I welcome anyone to reach out to me and we can discuss it further. Thank you. If your school has an existing COVID-19 testing program, we'd like to hear about it. So there is a link that is on the slide, and I'll also put it in the chat, and it'll be on the slides that I email. We'd like to hear about what you already have developed and ideas for the future. Cook County Health Department participates in the distribution of the rapid antigen test program. You may request Binax rapid antigen test kits using the following website. Also, you can request, once you are approved, there's a waiver process, and once you're approved, you may be able to request 25 test kits or 1,000 kits per week. Just based on the conversation we had with Beth Heller from SHIELD and our representative from IDPH, I decided to add this slide. If you're interested in ordering SHIELD or the Binax through IDPH, here's their email information, and they can ship to you directly. Or if you would like to set up SHIELD, you can also email them about that. You can either contact us for the Binax or you can contact IDPH directly. If you have an event that you would like a CCDPH professional to speak at regarding COVID-related subjects, you can submit a request at our Speakers Bureau website. That information and the link will also be put in the chat and sent to you in the slides. If you cannot get out of your house to get the COVID-19 vaccine. If you need help assisting getting your COVID-19 vaccine, if you have a disability, you're 65 years or older, you use adaptive equipment like a ventilator or a wheelchair, you can call the 833-308-1988 number to have someone come to you to vaccinate you. And also, you can also call this number if you need a ride to a vaccination site. And here are resources for school-aged children, age 12 and up. It's information on Cook County Health Department sites, on-site clinics, if you'd like to request an on-site clinic through Jewel Osco, and request a mobile clinic day. So all of this information is also going to be sent to you. And I'm going to toss it over to Lex. I'm going to stop sharing. And, I'm sorry. I forgot to say our chat is disabled because we want everyone to concentrate on the information that Lex is giving out. And I will open the chat towards the end to ask any questions. Thank you so much.
So before I get into it, I do have a couple of questions for you guys just to think about before the chat is opened up. The first question is, do you guys want me to continue to talk about metrics and include the travel map? Because after this week, I was kind of planning on having shorter presentations just focusing on what's actually new information. Pretty much everything is up on our updated website, like metrics, travel info, reporting tools, reporting guides, vaccine info, test requests, things like that. So that's all available and out there. So just think about it. If you guys want me to keep presenting on that, certainly I will continue. But if you're not really using that information, just let me know so we can cut these a little bit shorter, give you a little bit more of your Fridays back. We were also thinking of maybe inviting schools to present or share as well with us, if they've done something unique, like having a really creative and successful homecoming alternative event, or like a really successful movie night, or they've come up with like a cool no-touch PE game that kids ended up loving. If you guys feel like really strongly that you've done something really cool and want to share it with other schools, we would love to be able to share that with everybody who's on this call if you're comfortable. So in the chat, when it opens up, if you have an opinion about this, you'd be open to hearing from other schools, or you want to share, let me know. We're just trying to think of more ways to make this engaging while simultaneously sharing good and accurate and information that's actually going to be useful to you guys. So just a couple of ideas we had, especially like as we approach the beginning of the school year with ice cream socials or getting to know you events, and then homecoming, and then the holidays and things like that. So getting into it, as usual, we'll have housekeeping, how to request immunization records, the metrics update, travel guidance, layered mitigation strategies, how to set up testing in your school, what the quarantine options are and when it's appropriate to use which ones, more in-depth guidance on test to stay, and then of course submitted submitted questions. So first, as Kelly said, please fill out that testing program survey just so we can gauge, how many schools are actually using this resource. And then, of course, as always, our school email is ccdph_schools@cookcountyhhs for everything pertaining to school and communicable diseases. Right now, it's pretty much all going to be COVID, but if you've got mumps or chickenpox or whatever, certainly use that email as well. And then, not going to get too in-depth into this, but this is how you can request immunization records from your staff and students. If someone lost their vaccine card or something, you can direct them to Vax Verify that the state put out, which will allow them to get their vaccination records from iCare. So that link is up there too for you guys to pass out to people who need that. Only adults can access that also. If children lost their vaccine cards or a parent did, you're going to have to use a different way of accessing that. I cut out a lot of the slides on reporting school-related COVID cases and contacts because it's up on our website. You guys know the drill by now. But a few things I wanted to add is that you shouldn't be reporting individuals who are symptomatic but don't have any known connections to a COVID case. So like, I have really bad allergies in the fall. I might be having those symptoms, but if you don't know for sure that this person has had close contact with a case, they do not need to be reported to us. And then also, we had a couple questions, and these are really good questions coming this week. Please do report vaccinated close contacts to us because we can help them find testing or resources. And then, in case they go on to develop symptoms, we do want to have their information ready and available in case that happens. So please do continue to report vaccinated close contacts. And then as a follow-up, generally outdoor contact isn't going to be considered close contact and does not need to be reported. If there was somehow like a 15-minute wrestling match during recess without masks, do report those cases. But if it's like just a quick tag or some people ran into each other on the slide or whatever, obviously that's totally fine. We need kids to have a mask break, of course. So you do not need to report that contact. Update on our metrics, we are way up from where we were last week. It is not trending well. We are just a hair away from being in high transmission, which is the last level of transmission. But on the other hand, the good news is that 50% of our total population has completed their vaccine series, so that's really great. We are slowly heading in the right direction with that, heading in the wrong direction with cases, and as you can see from this graph of school-age people, we are already past where we were in September of last year. So for the younger age groups, we are actually doing worse than we were last year in terms of COVID cases. So keep that in mind. Delta is really affecting kids a lot more, and lots of kids can't get vaccinated yet. It is still a very real problem for schools. Hang in there with those. And then, as you can see in the travel guidance, the map is getting more and more orange. A lot of states are in the no-go zone. I won't go super into detail on a lot of this, but because we've had some questions, I just want to emphasize again, for unvaccinated travelers, CCDPH is following Chicago's guidance, and that is that they quarantine 10 days or until they receive a negative test, or they received a negative test within 72 hours of actually arriving in suburban Cook County, and they need to quarantine until they get those test results back. If you want to opt for the more conservative approach put out by IDPH and CDC, you are absolutely welcome to do that. If you feel like you've got a very mobile traveling school population, you may want to opt for that option, but the bare minimum is this Chicago guidance that we are asking everybody to follow for all the unvaccinated travelers. Our website should be updated so that it's more clear, but just since we've had a lot of questions, follow the Chicago guidance. It's as simple as that. All right, we will get into the mitigation measures. I think probably everybody has heard by now that there has been a school in Illinois that had their recognition taken away. So obviously that enforcement power is going to be used. the mitigation strategy slides are the same as they've been. We know vaccination is the best strategy. Obviously, masks are required, very important. Physical distancing, I will go in depth again because we still get some questions about this. So, in the classroom setting, 3 feet of physical distance is the close contact definition. So you can be closer than 3 feet if that's how the school room needs to be set up, or the classroom needs to be set up. But if you can't make that 3 feet, then you need to keep really detailed seating charts for contact tracing purposes. In classrooms, this means that desks need to be 3 feet apart edge to edge if you can manage the 3 feet distancing, or that, like, if they're at a lab table or you've got kind of like a circular table set up, students should be 3 feet apart, shoulder to shoulder, not center of head to center of head, since obviously kids are going to be moving around in their seats. Adults move around in their seats. So that's physical distancing in the classroom. Outside of the classroom, 6 feet of physical distance should be maintained. So that's your music rooms, your auditoriums, the gym, any kind of common space, computer lab, etc. And we did have a question about cohorting last week that I will address at the end with the submitted question. So hang tight for cohorting. Outdoors, students can remove masks, have that break. Don't, encourage contact sports or games like freeze tag or whatever, a Red Rover. But certainly you don't have to be really scrubbing down the outdoor equipment. It's okay. The elements are going to take care of that for the most part. So just make sure you're focusing on hand hygiene when you've got kids unmasked outdoors before you go out and then when you come in. And then, of course, avoid huge assemblies or large meetings. If they have to be held, have them outside, distanced. If you've got a big gathering, you should still be masked outside. Of course, it's important to set up a screening program if you guys feel like that's something your school is capable of. Reporting, testing, all important things. Have good ventilation while the weather is getting nicer. Hopefully won't have those crazy bouts of storms again. And then, of course, good hand hygiene. Staying home when you're sick. That's just always a good idea. No one's a hero if they come to work or school with a cold this pandemic. So contact tracing, obviously isolation and quarantine, cleaning and disinfection, those links are up for your reference. There's not a whole lot of surface transmission, but it is still possible. So clean things to the best of your ability without, ruining your equipment or letting it get in the way. It's always a good idea to just have wipes available for kids to wipe down their desks if they're going from classroom to classroom. And then how to set up testing infrastructure in your school. You've gone over this. Beth Heller did an excellent job talking about this last week. And honestly, with a number of things SHIELD can take care of for you, like the CLIA waiver and also administering Binax tests, that's definitely the easiest route and also free in most cases. So that's generally what we're recommending. But the options you have for testing are to have a screening program at least one time per week for unvaccinated students and staff, but you could have just your high risk sports teams being tested, and they might have to be tested multiple times a week, depending on what high risk sport they are and what the community transmission is. The CDC has guidance out on that, and then it was also in the previous week's presentations. If there is an outbreak, we are going to want to do testing. So it would be good to just have a testing program set up so you already have consent forms and a supply of tests so that we can act really quickly in those situations. And then the test to stay program, which I'll talk about in a couple of later slides. And then if we get to low transmission levels, we will hopefully be able to use rapid tests to return students to class. We are not there yet. Hopefully we will get there sometime this school year. All right, so quarantine options. We've had quite a few questions about this, so I do want to go in depth on this. For option 1, the individual, and this is the gold standard, as you all know, individual quarantines for 14 days if they're not vaccinated. Option 2, if they don't have symptoms by day 10, they can come back on day 11, no testing required. Option 3, they can get tested on day 6 with a PCR test, and if that's negative, they can come back on day 8. And this is, because we've had a few questions about this, this is available to both staff and students. So this is available to students if this is a route that the school and family want to take for that student. And then for option 4, the test to stay option, the details of this is, first, schools need to have a screening program in place. It does not have to be Shield. It could be like a private thing, a private company administering these screening tests, but the program needs to be in place for test to stay to even be an option. So that close contact will be tested on days 1, 3, 5, and 7 with an EUA authorized test. It can be PCR or antigen. Multiple testing makes antigen tests more accurate. Someone asked that question last week. So a singular test might not be as trustworthy, but multiples we can have a better read on. And then just as a reminder, initial exposure is considered day 0. So if the results are negative at each test on these days, the individual can continue to attend school or work. If testing is not possible on a specified day because it's a weekend or a holiday or an institute day, just have that individual tested immediately upon their return to school. And then we do need to know if an individual is participating in this program. The schools will, or Shield, if you've got Shield, will be responsible for all of that administration, but we still need to know if there's a close contact who is, you know, still actively attending everything that they do. And then obviously that individual has to remain asymptomatic the entire time. If a symptom develops, isolation needs to occur immediately, and this could mean they have to be sent home from school, but they really do need to be monitoring their symptoms. Another requirement of the test to stay program is that correct and consistent mask use and proper distancing has to be occurring at all times, like really at all times. This option is also not available to close contacts if the initial case was a household member and they are living with that person. So, and I'll go in more in depth in test to stay, but how do you know what quarantine option is right for somebody, and who picks this? So this decision is up for the schools and the families to decide which option they want to do. And then, you know, if it's test to stay, obviously you need to be talking to us about it as well at CCDPH. But some things to consider. What mitigation strategies do you have in place in the school building? Like, are people really consistently and correctly wearing masks? Are desks at least 3 feet apart? Is the school environment actually able to support someone who needs to strictly maintain their distance and keep masking due to the test to stay method? Is there a screening program in place? Obviously, that makes you automatically ineligible for test to stay if you don't have one. Does this close contact have access to tests in order to take a shortened quarantine? And then was that contact exposure, were they both masked at that time? Is the case a household contact? And then think about whether that contact is symptomatic. If they're symptomatic, they need to be home for the 14 days. There are no other options. And they should get tested to see if they have turned into a case. And then does the, looks like I forgot to leave off a couple words on this slide. I'll fill it in before we send it out. But does the contact participate in any high-risk activities like show choir or basketball or things like that? So maybe not every quarantine option would be available to them then. Does the school even have the bandwidth to be monitoring the student or staff member and processing multiple test results for them? We're always going to be recommending the 14-day gold standard option. But obviously the goal is to keep kids in school learning, especially, you know, getting them to their first and second weeks of school coming up. So those options are available, but 14 days is always the recommendation. And then shortened quarantines will be assessed and managed by the school and not CCDPH, but of course you can ask us and we will, you should also notify us when those are happening. All right, so a little bit more on test to stay. You can have a private screening program in place and not Shield if you want to be eligible for test to stay. But obviously, we have a really good relationship with Shield. Everything is more cost effective, so keep that in mind. If a student has opted out of the school screening program, we are not recommending they participate in a test to stay option. The school can decide that they have the time and resources to accept and verify private test to stay results, like if they just, go to a testing site on the days they need to be tested. But that's going to take a lot of verification and administrative bandwidth for schools. We will not be involved in this coordination. If you guys do want to have that option, certainly think about that, but we're not recommending it. If someone is exposed outside of the school environment, but is participating in the school screening program, like, for example, they were exposed at their part-time job or playing a travel sport, the test to stay option can still be implemented, but the school needs to be able to assess that masks were worn during the exposure. So, if it's like a job where that masking is going to be enforced and you have good faith that exposure was masked, then they can participate in the test to stay. But if you're not certain about that exposure, then maybe they shouldn't be involved in test to stay and they can take a shorter quarantine option. As I said before, household contacts are not eligible for test to stay because that exposure is going to be constantly happening. And then if a test to stay test is performed at school and it ends up being invalid, like the student ate right before they took the test or something, a second test can be performed if the samples haven't been sent out to be tested yet, like if it's a Shield test. But otherwise, that student's going to have to be sent home until the next test is performed. So a repeat test can be administered, but if you're not going to get your results like that day or the next day very early, then that student has to be sent home for that period. And then someone participating in test to stay can still participate in their extracurriculars so long as they remain masked and distanced 6 feet. And then for buses, something that's test to stay specific, ideally a student participating in test to stay should not be riding the bus during their quarantine alternative, but I recognize that this is a huge burden to ask of families and schools to find another way to get to school. So if this can't happen, that's okay. Maybe try to ensure that bus has better ventilation, open windows and stuff. But ideally, if they can find another way to get to school, that's what should be happening. And then for lunch, if a student is participating in test to stay, they should eat in a classroom on their own, obviously still supervised. If this isn't possible, it just really needs to be absolutely ensured that they are truly 6 feet away from other people. So that's how it applies to lunch. And then for band, if a student is participating in test to stay, they cannot play their instrument indoors if it's like a woodwind or a brass instrument. If it's a violin, that's a different story. But if the band can safely distance outside, they can play their instrument outdoors. Otherwise, the student will have to participate in some kind of alternative distance and masked way, whether it's a class, so they take some like music theory lessons, or if it's an extracurricular, maybe they just sit out for those days. Those are your options with instrument you're actually blowing into. Okay, so submitted questions. We had more than this, but I think I addressed some of them just when we went over the guidance. So first question, can I use the carpet or rug in my classroom for things like read aloud? And the answer is yes. The risk of surface transmission is pretty low. The most important thing here is to make sure kids are washing their hands. If it is medically necessary for a student to wear a face shield instead of a mask, is it written anywhere that they have to be 6 feet away from others? So if someone isn't able to wear a mask, they need to stay 6 feet away from others, even if they're wearing a face shield. And you can find that in the ISB FAQs, number 36, for written documentation there. And of course, you'll have this presentation as well. And then what is the definition of close contact on a school bus? So basically, just because the bus is not a classroom, the close contact definition is being within 6 feet, even when masks are being universally worn, for 15 minutes over a 24-hour period. So that's 6 feet for buses, since it's not a classroom. From the previous week, someone asked about cohorts and whether other rooms besides classrooms, if they're just the cohort using them, is that considered an extension of the classroom? And that was a great question. We talked about it this week internally. And we decided that if students are able to cohort and consistently wear masks correctly, the non-classroom rooms like the computer lab or the library, if it's just the cohort, can be considered an extension of the classroom, and the close contact definition then is within 3 feet. So hopefully that gives you a little bit of leeway there with your cohorts. And then also from the previous week, we had a question on test to stay in sports. If it's an outside sport, do athletes have to be masked in order to be eligible for test to stay if they are a close contact? And so there are 2 things to consider here. If the sport is a contact or is not a contact sport, so like tennis, cross country, golf, they do not need to wear a mask in order to participate in test to stay. That's totally fine. They can still be doing test to stay and being unmasked playing their sports. But if it is a contact sport, they do need to be masked or find an alternative way to participate without a mask outdoors. So like they could do conditioning, but they shouldn't be scrimmaging and having that kind of contact without a mask. So those are your options there. I am going to stop sharing and start taking a look at the questions. If we participate in test to stay, do students need to always be 6 feet distance, even in the classroom? No, the classroom close contact definition is still 3 feet, but anywhere outside of the classroom needs to be 6 feet. So they need to be properly distanced depending on their setting at all times. It can't be a classroom that's set up to be 3-ish feet. Like it really needs to be strictly maintained. Do we know when the updated decision tree will be released? I think, they were hoping to get it out today, but obviously that didn't happen. So it should be very soon, but it just takes a while for everything to be okayed. Does test to stay have to be a shield or PCR test? It does not. Binax tests can be used as well. When you use them in repetition, they are pretty accurate rather than like if you just used one test one time. And that has to do with something called pretest probability. There are some good YouTube videos on it if you want to get more in depth there. Travel guidance. Is there a 24-hour rule still in place? Meaning if you pass through a high-risk state or stay less than 24 hours, is testing still necessary? Yeah, so that's more like if you pass through, that's totally fine. You don't have to worry about that. If you're like, if you went to a family reunion in Iowa, which is orange right now, you should, even if you drive back on the same day, a very long day, then you do need to get tested. Like, you know, think about what you're doing within those 24 hours. And then, what is the exclusion policy for unvaccinated asymptomatic individual when a family member is symptomatic and needs to stay home or be sent home from school? I'm taking from this that the family member is symptomatic, but not necessarily positive. So if that family member was symptomatic and positive, that unvaccinated person needs to be staying home, and their quarantine starts on the last day of that family member's isolation. If this is just a symptomatic individual, they are allowed to stay, I don't have the link for this, but I believe it's 48 hours until that symptomatic individual gets their test results. And if it's negative, then it's fine. But if it's positive, obviously, then they need to go home. So they do have a few days in there to get tested, and they don't have to stay home during that wait. Do students participating in test to stay need to go home until the first results are received? So I'm guessing this is a situation where like they find out they're a close contact really quickly, because most people don't know they're a close contact by day 1. Sometimes it takes a few days there. But if they do know, they need to be quarantining until their first test result. That is correct. So they can come to the school, get that test, but until then, they need to be staying home if they know they're a close contact. Can we use iCare to look up the vaccination status of adults? I believe you can. Shouldn't be an issue. Pollock, you can certainly correct me if I'm wrong there. Can we still reference frequently asked questions for schools updated in June? Yes, they are working on updates. It's just taking them a long time to get it through. So everything I've presented here is up to date. So if there's any kind of discrepancy between this presentation and the FAQs, take what we've said. Otherwise, that is the current guidance. What is the reason why we can't use Binax when we're in substantial and high transmission? Why is it less reliable then? So this is kind of a complicated epi issue, and I don't want to get into a really confusing topic, but I would encourage you to Google pre-test probability and rapid tests, and you should get a couple of good articles from medical associations that will explain why in higher levels of transmission it's less reliable. I was under the impression we couldn't implement test to stay when in substantial transmission. So some jurisdictions that are not Cook County have decided that in substantial transmission, they don't want to do test to stay. But Cook is saying if you feel like you have the bandwidth to do test to stay and can do that administratively, then we fully support that as an option. We want to keep kids in school as much as possible. What is the optimal time to test with the Delta variant? Is it 3 to 5 now instead of 5 to 7 if a close contact? To my knowledge, there's not a different onset period for symptoms to develop, so I do not believe that has changed. Am I reading this right from the FAQs? An individual who is solely exposed to a confirmed case while outdoors should not be considered a close contact. Yes, this does apply to both vaccinated and unvaccinated people. So outdoor contact is generally not considered close contact. Like I said, if there's like a 15-minute heavy breathing wrestling match outside, yeah, that's close contact. But in most cases, brief contact outside is not going to be considered close contact. Is music class as a cohort considered an extension of the classroom as well, or should they be 6 feet? If they are not blowing into instruments, I think 3 feet would be fine. But if they are blowing into instruments, they really need to be 6 feet. That's super, super important. There's a lot of aerosols that are released when you play an instrument. Other than maintaining as much distance as possible, 6 feet or more, are there any other guidelines or recommendations if a teacher needs to use a face shield rather than a mask in order for their lips to be visible for a student who needs to read lips? The teacher would mask when not giving verbal directions or lecture. No, that sounds like absolutely the best situation for what you're doing with that student and teacher. Masks when they can, but when they can't, just stay 6 feet away. Should we encourage or ask staff to consider all the other screening questions besides self-screening for symptoms? Questions like, have they been in close contact with positive individuals? Have they traveled internationally? Assuming you're talking about self-screening like before the workday starts, self-screening is more just to get people in tune with how they're feeling that day. If they've been in close contact, they should not knowingly be attending classes unless they are, in the test to stay program. And if they've traveled internationally, they should be letting you know that has occurred. But I don't think that needs to be included in your daily questions. Next question, is a car used for driver's ed behind the wheel considered a classroom? No, it is not. There's not really any way to be properly distanced in a car. Do we quarantine household members if there's a family member with COVID symptoms? So just again, there is, and I'm sorry I don't have the documentation in front of me right now, but there is a period where you're waiting for that symptomatic individual to either test negative or get an alternative diagnosis, and during that period their household contacts who are also in school do not need to be sent home. Obviously, if they test positive or it's outside of that waiting period where they're waiting for those results, then they will need to be sent home. So I hope that clarifies it. You guys can keep the questions coming in, but I think it's time to start winding down. And just remember, at the beginning of my presentation, I asked you guys if you wanted me to include the metrics and travel map, and also if you would be interested in hearing other schools present on some things that have worked really well for them. If you have opinions, pop them in the chat or email us. I'd love to hear your feedback on that, just so you guys are getting the most out of this that you can. Can we please have that in writing about family members continuing to attend for 48 hours? I think that's in the FAQs, but I will write that down for next week to get you actual documentation and tell you where that is. And then one more question, can we still do test to stay when we are in high transmission? Yes, so we can still do test to stay when we're in high transmission, and we support that as much as possible, but we don't expect everybody to be doing test to stay because we know a lot of places don't have screening programs set up at the moment. So if that's an option everyone wants to participate in, that's fine. But there are still other quarantine options that make kids, not out of school for as long. Can we test everyone in a class for test stay? I guess whoever this person is who asked this question, if you want to email some more details for this situation. Otherwise, I am going to toss it back to Kelly. You can keep those questions coming. I'll type answers. Otherwise, we will answer them next week.
Thank you, Lex, for that great information. And thank you all for your support in attending these weekly meetings. If you did not get your question answered, if you have a question after we've gotten off, or if you'd like to suggest any of the presentations that Lex suggested, if you have any information, you can email us at ccdph.covid19@cookcountyhhs.org, and we'll get that information to Lex, and she can answer your questions ahead of time for next week, as well as you can communicate your ideas for upcoming webinars. Again, if you didn't log on in the beginning, we are recording our webinars and they are slowly being added to our website, so you can check that out if you would like to reference that or show your staff. Our webinar from 723 is posted. The rest will be posted when our media department has an opportunity to post those. If you have any questions or concerns, feel free to contact us. We appreciate you guys taking the time out of your busy schedule. I know that schools for some starts next Monday, including my teenager, so we are all super busy. Good luck, have a great weekend, and enjoy your Friday the 13th. See you later.